I'm Kirsten Williams, a beef and sheep consultant with SEC Consulting. Pre-lambing nutrition is vitally important because we're looking for the yow to be able to give birth, have the energy to do that, get back up. We want the lamb to be a good birth size and to be able to get up onto its feet quickly, and then for the yow to have a good quality and quantity of colostrum and for the lamb to be able to get up and suck that. The last part of pregnancy is when the fetus will grow the most. So the yow's energy requirements in the last 6 weeks will increase by 60%. So tailored nutrition is vitally important for that period. We're looking for good quality ingredients in the ration and to maximise the forage that you have got. Ideally, we want the lamb to get up quick onto its feet to suck colostrum. And the colostrum is full of antibodies for the lamb. It prevents it against bacteria infections such as joint ill and navel ill, watery mouth. That colostrum is ideally from its mother, from the yow. The ability to absorb the antibodies only lasts for the first 24 hours of birth, and the sooner that colostrum gets into the lamb, the quicker. So ideally we're looking for 50 ml per body weight in the first 2 hours of birth. The lambing shed has to be completely hygienic. So we're trying to reduce that bacteria getting into the lamb. Think of a newborn baby and how clean the hospitals are. That's what we're looking for the lambing shed. We're looking for the ultimate hygiene. So we want there to be no guttering leaks, no water trough leaks, really clean surfaces. We don't want a high stocking density so that the bedding isn't being used quickly and getting dirty quickly. If you kneel down and your knees are wet, generally your bedding's wet. So we're trying to keep it as clean as possible to reduce that bacteria. When the lamb goes to suckle, it will be picking up bacteria from the udder, from the wool, from the environment. And it is just trying to minimise that potential at all times. Colostrum is vital, hygiene is vital. Once you've got the nutrition, the colostrum and the hygiene, lamb survival will be higher. You also think in indoor scenarios about iodine, and if you can dip the navel with iodine fully and the whole navel gets covered, ideally as soon as possible after birth, and then if you can double dip, so dip it again 2 to 4 hours later just to help dry it up.
There's a possibility this year that there might be a shortage of iodine. And when we dilute iodine solutions to less than 7%, they can lose some of their efficacy and not work as well as we would want them to. So we're looking at alternatives that farmers can use this year should there be a problem with iodine supply. So this includes a 4% chlorhexidine solution. Chlorhexidine is most commonly sold as Hibby scrub, and you can use it as either a straight 4% solution or mix it 50-50 with some alcohol. And that has proved that to be roughly equivalent as 7% iodine when used as a navel dip. Alternatives are Vetracin's Super 7 solution. It's less drying than iodine, but hasn't been shown to have any increased infections associated with its use. There's other solutions such as 70% alcohol. It's quite drying, but it doesn't have as long-lasting disinfectant efficacy. And then there has been a product called Rapiderma tested, is roughly equivalent with drying and disinfection, but to only 4% iodine, so it might not be as effective as the others. So prophylactic treatment is a term used when you treat every lamb born with an antibiotic to prevent bacterial infections. This isn't a good idea from a bacterial resistance point of view. The more bacteria exposed to antibiotics, the more resistance occurs, and this resistance can be a problem when it comes to treating bacterial infections in both human and animals. So there's obviously a little bit of concern with the possibility of less iodine being available and Spectam, the prophylactic treatment for watery mouth, being off the market. But ensuring good colostrum management, good environmental hygiene will decrease that risk. bacterial infections happen when the bacterial challenge from the environment overwhelms the immunity provided by your colostrum. So if you've given a lamb sufficient colostrum and have them in a clean environment, that challenge should be relatively low, and so we should be less concerned about the risks of bacterial infections. So there may still be situations where antibiotic treatment is needed, and when those occur, you should talk to your vet about using antibiotics responsibly and using them in the right animal at the right dose at the right time. So when we think about preventing bacterial infections in lambs, we're really thinking about good colostrum management, good ewe management, and good environmental hygiene.